A puncture wound is a forceful injury caused by an object that penetrates the skin. Sharp objects such as nails, knives, teeth, and needles can all cause puncture wounds. When you have a puncture wound, determine whether 911 needs to be called. Small objects such as small splinters or staples can be handled with simple first aid. Determine whether any part of the object that caused the wound is still in the wound, such as a splinter. Clean the wound and remove any dirt or debris to prevent infection. Puncture wounds have a higher risk of infection than most other wounds. If there is a large object penetrating the skin, carry out the acronym AID. Do not remove the object. If the object is removed, it could become immediately life-threatening, as it may be stemming the flow of an artery. Instead, leave the item in place and use roll bandages or dressings to support and stabilize the object. Then wrap around the item with gauze to secure and stabilize the item in place. Try not to put pressure on the embedded object. This procedure will help reduce movement, which will help further reduce damage to the tissues. While waiting for 911, continue to care for the victim. Assure the victim is breathing normally. If they are not breathing, begin CPR. As with all major illnesses and injuries, treat for shock. If an object is embedded in the eye, do not remove it. Stabilize the protruding object with a clean, bulky dressing. For small protrusions, place a paper cup over the eye and secure in place. Since the eyes move together, be sure to bandage both eyes to limit movement and reduce further damage.